reasons why I co-founded this clinic is because I saw a real need. We see patients who do not qualify for Medi-Cal, but don't make enough money to buy private insurance. So it's really the working people who fall through the cracks. And so Clinic by the Bay is there for them because we truly do believe that access to medical care is a right.
At Clinic by the Bay, we practice the art of medicine rather than the business of healthcare.
What I like is that we get to take care of people without having to worry about anything but what's right for the patient.
I feel really good about volunteering here. I just really enjoy being boots on the ground, making a tangible difference every time I come into the clinic.
Doctors here really take the time to get to know the patient.
With the amount of time that they have here, you get to build these patient relationships.
All the patients, they just feel like my aunts, my uncles, my grandparents, and I just love being able to be here for them.
My parents were immigrants, and so they relied a lot on free health clinics. I am really proud of volunteering here because I get to give back to that community.
What makes Clinic by the Bay unique is that we're really able to tailor our services to meet the needs of our patients and develop programs that really support their health.
These are people who are trying to make ends meet. They've been bounced back and forth between health systems, and this is really the only safety net that they have available.
I was walking on the street, and then when I see the sign, they say it's free. So that's why I talked with the people who was in there.
I've tried other places, and they declined me. I'm so glad I had a friend that recommended this place, because I'd be in a bad spot right now.
I signed up for COVID California. It stressed me out because of the financial difficulties I'm in. I worry that I can't pay it.
The services are excellent. I feel that I've been taken care of. I get reminded on a monthly basis what I need.
From day one, I felt they're caring. You're not just a number. I said, oh, someone's gonna help me, because I really needed it.
Being a patient here is like being with family. Feels like home.
Clinic by the Bay is the one that really helped me to make myself a whole again.
Thank you, Clinic by the Bay, but everything you've done.
Clinic by the Bay really saved my life.
Keep giving. It goes a long way. It keeps paying itself forward.
Thanks to that beautiful video, you understand exactly who Clinic by the Bay is, and you might have recognized Sarah Gordon. I'm Susan Noyes, the founder of Make It Better Media Group, which includes Marin Magazine, Better, and the Make It Better Foundation. Clinic by the Bay won one of our foundation's Philanthropy Award, and we're delighted to be able to host this fireside chat with Sarah Gordon to help spread the word. Please send any questions or comments through the chat at any time, and we will try to address all of them. But also, please know that a video of this event will be sent to everyone who registered for today's event. It will also be put in MIB TV and on our YouTube channel, and included in an article summarizing top-line advice featured in an upcoming Better Letter email newsletter that goes to over 100,000 people in the Bay Area and Chicagoland, and pushed through our social networks. By the way, if you don't receive our bi-weekly Better Letters, we highly recommend that you subscribe through the link in the chat today too, because absolutely everything we write and do amplifies your social impact and connects you to trusted resources, helping you make your life and the lives of others better too. And now I'm delighted to officially introduce you to Sarah. She is a fifth-generation San Franciscan with a true calling for public health and social justice. After graduating from San Francisco State University with her degree in community-based public health, she worked in federally and state-funded, more traditional community health clinics before finding her way to Clinic by the Bay, which serves southern San Francisco and San Mateo counties. Welcome, Sarah. Please tell us more.
Great. Thank you, Susan. I'm going to go ahead and share my screen. Make sure. Can you all hear me okay? Yeah? Okay, great. Great. So thank you, Susan. Hi, everyone. I'm really excited to be here today to tell you about Clinic by the Bay and the work we do to provide free healthcare to the uninsured members of our community here in San Francisco. So as Susan mentioned, I'm a fifth-generation native San Franciscan, and social justice and access to healthcare have always been a huge passion of mine. And prior to coming to Clinic by the Bay, I worked for many years in federally qualified health centers, or FQHCs. And the work that these FQHCs do is a critical component to our healthcare safety net system and is imperative to the health and wellness of our communities. But those clinics are caring for the individuals that qualify for health insurance or can afford to pay the cost of their health insurance premiums. And they're typically limiting their services to what can be billed for and reimbursed by Medi-Cal, which is California's Medicaid. And they are trying to maximize those reimbursements by squeezing in as many 15-minute visits as possible. So at Clinic by the Bay, we really are the safety net of the safety net system, catching the people that fall through the cracks because they either don't qualify for Medi-Cal or simply can't afford to pay for health insurance while caring for themselves and their families, working low-wage jobs, and living in the Bay Area. And the way we do this is so special and unique since we're not limited to only providing services that can be billed under Medi-Cal. We can take as much time as we need with our patients. Our visits are generally 30 minutes to an hour, and we can develop programs and services that truly meet the needs of our patients and support the whole person. So let me start by giving you a little background on Clinic by the Bay. We were founded on a simple but ambitious goal to operate a free volunteer-powered health clinic that provides high-quality and culturally sensitive primary care to the hardworking uninsured members of our community. So in 2008, our co-founders, Janet Riley and Scott Hauge, conducted a comprehensive needs assessment and found that the Excelsior/Outer Mission neighborhood was a medically underserved area that would benefit from a primary care clinic. The number one barrier to healthcare was identified as cost. And even with the Affordable Care Act, there are estimates that over 80,000 individuals in San Francisco and San Mateo County remain uninsured. And a large percentage, over 20%, reside in our neighborhood, San Mateo, the Mission and Excelsior districts in North San Mateo County. And we believe these numbers have increased since the pandemic as people have lost jobs and health coverage. So through this needs assessment, we knew that the priority needs included primary and preventive healthcare, mental health, dental, chronic disease, and as we know is a huge need across the country, access to low-cost prescription medications, all of which continues to be a need today. So I included this map of San Francisco to show the area where we are located in, which is in the southernmost part of the city, where we know there's limited access to vital healthcare services. The more affluent areas of the city are at the top of the map, and the northern parts of the city, the Presidio, Marina, Pacific Heights. And this is the area where the only other truly free clinic in San Francisco is located, so on the opposite end of the city. So here are some milestones for Clinic by the Bay over the years. We registered as a 501c3 nonprofit in August 2008, and our founders spent 2 years planning and setting up the clinic, raising money, and securing volunteers and staff. And then in November 2010, we saw our first patient, and then became a state licensed clinic in 2015. And due to a growing need for mental health services, we began providing counseling to our patients in 2016. And in 2019, we expanded our chronic disease program by launching an innovative health coaching program, which provides individualized supports for our patients with chronic conditions. And after an expected drop in patient numbers in the passage of the Affordable Care Act, we've steadily grown since that time, mostly due to strong word of mouth and referrals from our patients. And in 2020, we reached over 23,000 visits. And then in 2023, we'll be moving to our new location and expanding services, which I'll talk about towards the end. So what makes Clinic by the Bay unique? We provide volunteer-powered free healthcare for the working uninsured. As we like to say, we practice the art of medicine and not the business of healthcare. And because we engage retired doctors and nurses, the majority of our services are provided by volunteers. And since we don't bill insurance, we can really take as much time as we need with our patients and ensure that all their healthcare needs are being met. And this is something our volunteer physicians really love. And one thing to highlight here is that, through our network of volunteer physicians and nurses, we're really able to tap into the various specialties that these volunteers have practiced throughout their medical careers. So when we have patients whose healthcare needs go beyond the primary care, we can utilize our in-house volunteers to access specialized care like cardiology, neurology, dermatology, physical therapy, instead of referring patients out for these services. And then anything else that we can't provide in-house, we refer out to through our strong partnerships and collaborations that we rely on for specialty care like diagnostic testing, screenings, mammograms, colonoscopies, and outpatient surgeries. So as I mentioned, our typical visit is about 45 minutes. Versus the typical 15-minute visit you'll see in health centers and commercial medical offices. And our primary affiliation is with Volunteers in Medicine. We're one of 94 Volunteers in Medicine clinics across the country. And Volunteers in Medicine is a national organization that engages retired and practicing doctors, nurses, and other medical and non-medical volunteers to provide healthcare free of charge in clinics like ours. We engage around 100 volunteers per month, and 30% of those volunteers have been active for more than 2 years. We do not rely on taxpayer dollars, and we do not do any insurance billing, and we're 100% supported by private foundations, individual donors, and businesses. And then half of our operating budget is provided in kind by the services through our volunteers and through donated supplies and goods.
Could I ask a quick question here?
Sure, of course.
When you say in-kind donation, could you specify exactly what that is in case somebody else might want to do the same?
Absolutely. So that includes any donated supplies or materials. We get a lot of donated medications, supplies for our exam rooms, cleaning supplies, needles, syringes, things of that nature that we need to use to provide services. And then in-kind also includes all of the volunteer hours that are donated by our medical and non-medical volunteers. So again, that is basically doubles our operating budget for free services that are being provided to our patients.
And can audience find a list of those desired donations on your website?
Absolutely, yes. I'll have the link to the website at the end of the presentation, and it'll be shared in the chat as well.
Perfect. Thanks so much. See you later.
Thank you, Susan. Thank you. All right. So just a little bit more about our patients and who we serve. So we really strive to eliminate health disparities in our community among our low-income, uninsured adults who are primarily immigrants. About 85% of our patients are immigrants, and non-English speakers. About 60% of our patients are non-English speaking. The majority of our patients are Hispanic and Asian Pacific Islander, and most are over 40 years old, and an increasing number have chronic conditions, including diabetes, hypertension, high cholesterol. And prior to their first visit as our clinic, 30% of our patients have not seen a doctor in 1 to 3 years, 12% have not seen a doctor in 3 to 5 years, and 10% have not seen a doctor in over 5 years. All of our patients are uninsured and must have incomes below 500% of the federal poverty level. And patients go through an eligibility screening prior to becoming a patient at Clinic by the Bay, but we're typically able to get people in to see a doctor within about 2 weeks of being screened, which is better than the national average of about 4 weeks. All of our patients reside in San Francisco or San Mateo County. And the majority of our new patients come to us by word of mouth, and 100% of our patients report that they would recommend Clinic by the Bay to their friends and family. A little bit more about what we do. So as I mentioned, we provide volunteer-powered free clinic for the working uninsured. And in addition to primary and preventive care, we also have mental health counseling. We have a free pharmacy where we can dispense donated medications. And for anything we don't have in-house, we enroll our patients into prescription assistance programs. We have in-house specialties based on our volunteer medical providers, and then specialty referrals through our network of partners. We do health coaching and chronic disease management, including the work that we do through our innovative Food as Medicine program. We have physical therapy, vaccinations, including COVID vaccines, and neurology, dermatology, and more. And then we also serve as a training and experience environment for medical students, interns, residents, and more from Kaiser, UCSF, CPMC, and we host students from local colleges and universities as well. So on to the future of Clinic by the Bay. We are currently in the middle of a capital campaign. Just a little bit of history about the building that we are currently in and what we're moving into. We are currently in a space where our exam rooms are shared with a chiropractic office next door. So we move in our stuff in and out on the days that we see patients. It's truly community medicine. So the setup is not ideal. We have carpeted floors, chiropractic exam tables. So a few years ago, a wonderful opportunity presented itself, and Clinic by the Bay will be moving into the old Alamany Emergency Hospital, which is 1 block from our current location and has a deep-rooted history in the neighborhood of supporting families and providing free medical care in the Excelsior neighborhood. So we're really excited. We are restoring this historic structure and returning it to its original use, a site for free healthcare for our community, particularly our low-income working class neighbors. And this space will allow us to address many of our current challenges that really limit our ability to meet the growing need for affordable healthcare. It will also allow us to add dental, expand our free pharmacy, which are urgent needs for our community. So we need you. We need you to volunteer and to donate today. Support from our community through donations and in-kind services have kept us providing free healthcare services to thousands of uninsured individuals over the past 12 years. And it is what will sustain us into the future as we expand and provide even more services to the individuals who need it most. So thank you so much for being here today and learning more about Clinic by the Bay. And if you're interested in donating, you can find links on our website, clinicbythebay.org. And I believe links will also be posted in the chat. And if you're interested in volunteering, you'll find links on our website and in the chat as well. You can follow us on the socials. And I'm happy to talk individually with anyone that wants to learn more. My contact information can be found here as well. And thank you so much.
Okay, that was a great presentation. Now I'm really looking forward to digging into your proof, your data, the kind of compelling information that you present to close that capital campaign. So I would love to know, what are the outcomes from Clinic by the Bay versus the other federally and state funded healthcare centers?
Absolutely. Well, first, I think we're all consumers of healthcare ourselves, so we all know how satisfied or unsatisfied we are with our own healthcare services. So, I think one of the biggest proofs of our success, the success of our model, is really our high patient satisfaction numbers. We survey our patients annually and find that, over 100% would recommend Clinic by the Bay, and over 90% feel that their health has improved because of the care they receive at Clinic by the Bay. And of course, we also look at clinical data, and our patients have better clinical outcomes for diabetic indicators like hemoglobin A1C numbers, decreases in blood pressure for hypertensive patients, decreases in BMI for individuals who are overweight or obese, than patients with commercial insurance. The majority, as I said, the majority of our patients come to us having not received care in quite some time. So they come to us very sick. The biggest majority of our patients are suffering from chronic disease. So we really take a close look at those indicators and make sure that we are helping to reduce those chronic disease numbers and indicators, and support them through not just medication management, but also wraparound services, providing healthy nutrition, health coaching, really working with our patients one-on-one to change their lifestyle, make diet changes, nutrition changes, physical activity changes, to really support that whole person care.
And I've seen two sets of numbers. One was that about 80,000 people in in the region that Clinic by the Bay serves are uninsured and would qualify for this. How many patients do you serve right now?
We have just under 1,000 active patients that have been seen in the past 3 years at Clinic by the Bay. And, I think a lot of us, we're still constrained by our space. And so moving into this new facility is really going to help us expand our services, expand our scope and our reach, and provide care to a lot more individuals. So through this campaign, we're doing a lot of outreach, a lot of, connections with local businesses and community members, to really be able to increase those numbers, get more of those uninsured in with Clinic by the Bay.
And the money that it saves society in the long run is probably exponential, because now those chronically ill people aren't going to an emergency room when it's really bad, and taxpayers have to fund that.
Exactly. It's a very difficult number to capture. So I don't have that exact number, but we know that the work that we are doing is keeping our patients who would otherwise only be accessing care in emergency rooms or urgent care centers, keeping them involved in their medical care, keeping them healthy, so they don't have to, go to the emergency rooms for what could be handled in a clinic setting.
So
Absolutely.
there's a great question that's come in. How have your cases and needs changed over the past 2 years? That certainly would include COVID. And my guess is that you had a substantial COVID response too.
Absolutely. And, I think we really saw an influx of patients because of people, losing jobs at the beginning of the pandemic. A lot of our patients are frontline workers. So they were getting sick. They don't have employer sponsored health coverage. So we did do a lot of remote services. We started providing, blood glucose monitors, blood pressure cuffs, things that our patients could use to monitor their health at home. Did a lot of telephone visits, but also expanded our services to be able to provide, healthy staples through our food as medicine program, things that our patients were struggling to access, as well as vaccines when vaccines were still really difficult to come by. In high demand, we were able to get COVID vaccines and provide them not only to our patients, but to the broader community in San Francisco and San Mateo County as well.
That's fantastic. You mentioned partner organizations, sometimes referring. Could you give us an example of the partner organizations you currently work with and what you might want in the future as you grow?
Absolutely. So we, our biggest partners right now are through UCSF that's the University of California in San Francisco, for lab services. So we don't have the ability to do labs in-house in our current location. So we have a partnership with UCSF and with LabCorp to refer patients out to get labs. And then we get those results. So we're able to have, a more informed visit with the provider. We have medical residents from local hospitals through Kaiser, CPMC. And then we refer out through CPMC for mammograms for our patients. So we have a partnership with them to get those for free cost for our patients. That's still a large need of ours, is, diagnostic imaging resources. That's a big expense and a big, challenge to access. So that's definitely a need that we still have. And then another large partner of ours is called Operation Access. They work in all 13 Bay Area counties and provide free volunteer outpatient surgeries. So we are able to get our patients in for outpatient surgeries through Operation Access, which is a huge, huge help and free for our patients.
That is fantastic. So you've spoken a lot about your volunteers, and it sounds like it's retired doctors and other medical professionals. Who else can volunteer there and should consider volunteering there?
Absolutely. Anyone and everyone. We have a whole range of volunteer positions. We have a very small paid staff. There's currently only 6 of us. And the majority of our services are provided by volunteers. And that is from front desk to outreach to eligibility. Our food as medicine program is managed by volunteers. And then we have volunteer medical assistants and EMTs, nurses, doctors, specialty providers as well. So it runs the full gamut, and the majority of our services that our patients receive are done by volunteers. And then the staff is really there to support those efforts. We are there, day in and day out to make sure our volunteers have everything they need to do their jobs. And we're there to kind of keep the lights on and keep the place running and keep our patients and our volunteers happy and healthy.
And as an example of what the quality of the environment is that you've created, there's a lovely note saying, "So proud of you, Sarah," from the Clinic by the Bay team.
Hi, Carla. Thanks, guys.
Let me see. Can you give me any other stats? So you said 80, currently serving 1,000, at least 80,000 in the Bay Area need this service. You referenced one other clinic in the, I think the northern end of San Francisco, the city. So what is the unmet need?
Well, because, there's a lot, San Francisco is a resource-rich area, but we have a really high need, lots of low income, lots of uninsured individuals, lots of people, homeless people living on the streets, as I'm sure a lot of people around the country are familiar with. And really, the poorest of the poor are the ones that qualify for completely free or subsidized health insurance through Medi-Cal, which is California's Medicaid. So they're cared for, and there's a lot of those federally qualified health centers that I used to work for across the city, and they are caring for those individuals who really are the poorest of the poor. And then there's the people that can afford private health insurance, and so Clinic by the Bay is sort of falls in between, right? The people that don't qualify for free or subsidized care, or can't afford care for private, private insurance. So we really are that safety net of the safety net system, the people that don't, qualify through any other means. And there's only one other truly free clinic in San Francisco. And as I mentioned, it's in the northern, more affluent part of the city. It's not a volunteers in medicine clinic like we are. So we really are, a truly unique model, within the Bay Area, that there's no other organization that does it like we do. So.
And it's just so easy for me to imagine that if we can help scale what you do, again, we save society a lot of money in the long run because of this.
Absolutely. And I think, we all know how kind of fragmented and broken, our healthcare system is in this country. And, until we have universal coverage for all, really clinics like ours need to exist and make sure, people can access care to lead healthy and productive lives. If Clinic by the Bay wasn't there, our patients would have no other means to access healthcare services other than showing up in the emergency rooms, which, as we know, costs society a lot of money.
So how many other free clinics are there that are part of that national association you mentioned?
I believe we are one of 94 volunteers in medicine clinics, and we are one of the only, if not the only one, that is in an urban area. So the majority of those clinics you'll find in rural areas across the country. And so, we're pretty unique in even within that model of volunteers in medicine, but that national organization, really what they do is engage retired and practicing doctors and nurses who have spent their lives doing this kind of work and, want to continue serving their community, keep up their clinical skills, and really engage and help people. And our volunteer providers, they love us. We love them. The experience they get, even the students and residents that rotate through Clinic by the Bay have such a rich experience and get to learn so much and do so much with our patients and really provide that whole person care that you don't get to see in a lot of other facilities. So it's pretty awesome.
I'm actually speaking with you from Wilmette, Illinois. Better is really based in the Chicago area. And there is a free clinic in Highwood, Illinois, which is exactly next door to Highland Park, where those horrific shootings happen. And that clinic in Highwood was inundated, in addition to the rest of the healthcare system. So the more of those that we can grow, the more impact we can have too.
Absolutely. You just gave me chills, and yeah,
circumstances.
Yeah, absolutely.
So let's talk a little bit more about COVID. What do you see happening around COVID now? Do you feel like it's under control?
I don't.
Going back to the dark days.
I'm not sure, and I would always refer to my medical director for his clinical expertise in this. But I think in San Francisco, we had a really strong public health response to the pandemic, which I'm very proud to have been a part of. We've got a great public health system here in San Francisco, and we're a small city, but we really came together to put regulations in place, masking and vaccination requirements. We have a really high vaccination rate in the city of San Francisco. And I think we're also really cautious when I've traveled to other parts of the country or even outside of the Bay Area. There seems to be, people are a little bit more relaxed about it. So we're still cautious, cautiously optimistic for sure, but definitely still cautious. And, we know how detrimental and horrible COVID infection can be on individuals who suffer from chronic diseases. It can exacerbate those problems, more death and, less ability to kind of power through it, potential for long COVID. So we really want to do our due diligence of protecting those individuals and making sure we can do everything we can so that they don't get infected with COVID. So we continue to do COVID vaccinations and education around COVID, not just for our patients, but for the broader community.
That's great. So for anyone who doesn't really understand this, the winners of the Make It Better Foundation Philanthropy Awards, and there were only 3 in the Bay Area, are proved to a panel of expert judges that they are truly a venture philanthropy, that they are efficient and excellent and have strong leadership. And anyone who donates to it can be certain that their money is going to have maximum impact. So I feel like everything that we just discussed only proves that the judges chose well. And we're so very grateful for the great work that you're doing. Is there anything else that you would like to tell our audience?
Just that we can't do what we do without the support from our community. And, like I said, we all know kind of how broken and fragmented our system is. And, unfortunately, until we have a bigger effort towards making sure people have health insurance, places like Clinic by the Bay are going to need to be there and really providing this community response to this uninsured epidemic. So we really do rely on our volunteers. We rely on our donors. So just please spread the word. Please reach out if you have other questions or things that you might be interested in. I'd love to chat. And, I'm just really proud of what we do. It makes me happy every single day to go to work and to take care of our patients. And I think it's just a beautiful thing. So thank you.
So there is another great question that just came in. Based on your model, it does sound like you make $1 go a long way. Can you suggest what a $100 donation or a $10,000 donation or a $1,000 donation would buy so that donors who are watching this can really think about that?
Absolutely. I mean, we have, like I said, we have a wide range of support services that our clinic provides. So a $100 donation could feed one of our patients for a month in our food security program. We provide food vouchers. We have a food pharmacy where we give out a box of food. We have food box deliveries to our patients. So $100 can go a long way.
Yeah. 100, not too many people can eat healthy food for only $100 in a month. That is impact.
It's pretty amazing. Yes, pretty amazing. And that all supports our patients with their chronic disease management. And $1,000 could help support vaccinations. We get COVID vaccines for free, but we pay for the other ones that we provide to our patients. So $1,000 could go a long way for vaccinating our community. $10,000 could do that exponentially, providing diagnostic image services, anything that we can't make through our partnerships that we want to be able to provide for our patients. A lot of services that can be provided through that.
And that capital campaign, how close are you to fulfilling it? And I would think that people could think about a $10,000 or more donation with respect to funding a specific thing that would go in that beautiful new building.
Absolutely. We are pretty close to our goal. Our goal is 5 million and we're about 95% there. So we are in the home stretch, and that has been, labor of love, but a lot of really amazing donations. $10,000 or more can go to, supporting equipment and supplies, and really the build out of this historic building. It's still just kind of bare bones. So what we're doing is turning it into this, state of the art clinic. We'll have our own exam rooms with our own exam tables. All of our, we're looking for really great high-end supplies. And then we're also adding dental. So that's a huge need for our community and a new service for Clinic by the Bay. So we are building a 2-seat dental suite. So we'll be able to provide free or low-cost dental services for our patients, which, as we all know, is sort of separate from medical care and any medical insurance you have. So just imagine if it's a struggle for people to even get health insurance, dental insurance is even farther down on the list of priorities. So we're really excited to be able to provide dental services through our capital campaign.
And are there naming opportunities associated with larger gifts?
There's a few left. So yes, please feel free to reach out to me. But, like I said, we're 95% there. So we do have a couple of exam rooms, some areas within the clinic that we have some naming opportunities available. So if anyone's
interested.
That
would feel really good to somebody.
Absolutely. Absolutely. We would love to have your name on the wall.
Great. Well, thank you so much for spending the time with us today, and also for all you're doing for the world. You absolutely glow. You light up as you talk about this. You have a true passion for it.
Oh, thank you so much, Susan. And thanks everybody for attending. I really hope it was interesting, and I hope you learned something, and I hope you can help support Clinic by the Bay.
And again, the articles and the videos and the YouTube will have a call out and your email for anybody else who wants to follow up. And we anticipate that you'll be hearing from people for a long time going forward because of this.
Yay. Thank you so much.
Thank you, Sarah.